So if asked, most of you would probably say you would want to die peacefully, perhaps at home with family and friends, or in your sleep. Most of you would not choose to die in pain and agony, or be unable to control your bodily functions, or be mentally unaware. So at first, the idea of physician-assisted death, or PAD as we will call it today for short, brings on a negative response. And after all, there is a negative stigma that goes along with the word suicide. However, upon closer examination, it is clear that physician-assisted death does respect social diversity and the patient's autonomy by providing a dignified way for that person to die. This also protects the patient from unwanted and unnecessary medical procedures. So physician-assisted death, as you can tell, brings upon a heated debate culturally and religiously and ethically as well in the United States and across the world. So today our plan is to talk to you guys and educate you on the specifics of what physician-assisted death is, its current legal status, and how us as medical providers can encounter it and interact with it throughout our careers.
So two terms that you may hear used interchangeably that are actually different are euthanasia and PID, which is physician-assisted death. Euthanasia is when the physician performs the intervention, whereas what we're talking about today is about the physician providing the necessary means and information to the patient and the patient actually performing the act. There's very strict criteria and for patients to be eligible for PAD. This includes being 18 years or older. They have to be a resident of one of the states in which it's legal, which Nicole will talk to you guys about in a second. The patient also has to be capable of making decisions and healthcare decisions for themselves. They also have to be diagnosed with a terminally ill disease that will lead to death within 6 months, which we found can include ALS, terminal cancers, and chronic COPD.
So as you can see from this, these are the states that are legal right now. The 3 states are Washington, Oregon, and Vermont. So it's not a lot. And then there's the bills being submitted. So then there's other states like New Hampshire, Massachusetts, Connecticut, New Jersey, Pennsylvania, Kansas, and Hawaii. These are states that have the bill. They're about to pass it, but it's just going to be probably another year or 2 until it's passed. And then you have a couple states like New Mexico and Montana, and these are states that it's court decision. So it has to go to court or it's by county. So some counties have it legal and then they're trying to make it legal in the whole state. So when we're becoming physical therapists, we're most likely going to see an increase in legality, and that's why it's such a big, important issue for us to deal with. So you're probably thinking this is a rash decision. Somebody is sick and then they want to die automatically, but there's a really big process that goes into it, and the first thing you have to do is make an oral request to your doctor. And then you have a 15-day waiting period. This is a time for people to think about what they want to do, talk to their family, their friends, make sure that this is the right decision and how things are going to go on if they do decide to go through with this. The second is another oral request to your doctor. They really want to make sure that this is the right decision that you want to do to end your life with dignity. And then after that's approved, you have a written request. Once your written request is approved, there's a 48-hour waiting period before your medications are prescribed. It's important to know that once you get your prescription, you don't have to do it. You can say no, you can back out. It's not like you get your prescription, that's it. And that's the difference between PAD and euthanasia. So euthanasia, the doctor would be doing it. So this is very much an example of patient-centered care, so the patient has autonomy to make the decision with the support of their family, friends, and doctor.
As Nicole said, a lot goes into making this decision, not only just for the patient, but also for the physician. Each state has different protocols and requirements that the physicians are required to follow. We found some of the most important ones that showed up among different states to be that the patient also needs to be informed of alternative resources such as palliative care, pain management, and hospice care. If the physician believes that the patient has clinic impaired judgment, they need to be referred for a psychological exam. Also, the physician's diagnosis has to be certified, or certified by a consulting physician who also needs to certify that the patient is actually mentally capable of making decisions. The physician must also require that the patient request to notify their next of kin of their prescription to end their life with dignity.
So once the patient has decided and they've been approved by their doctor, they're prescribed the medication, which is, you can either get it in liquid form, which is easier to take for the patients. It's about $1,000 for the lethal dosage, or you can take it in a pill form, which is more difficult. They actually have to break apart about 1,000 pills to get the powder from inside to make the concoction. That's about $125. So you can see that comparing to the price they would pay for healthcare for the rest of their life, it's really not too expensive. However, it's not covered by insurance because it is considered a lethal medication. Once they take it, they can do it in the privacy of their own home, with their friends and family surrounding them, or alone. But they do have to have a healthcare provider around, check their vitals, and make sure everything's going smoothly and the patient is comfortable. Once they take the medication, it's about 5 minutes before they pass into a peaceful coma and about a half an hour before they peacefully pass without pain. So this is obviously a big ethical issue, PAD. So there's going to be a lot of opposition, especially in the United States. The two biggest groups that oppose it right now are religious groups and disabilities groups. The religious groups believe that this is not a natural way to die and that it's considered suicide, and we know that there's a stigma around the word suicide, which is why we're using physician-assisted death now. And the other is the group disabilities rights advocates. And these are people with disabilities, and they believe that sometimes people could be bullied into this decision if they are considering themselves a burden to their family or economically or even just day-to-day life. They might be encouraged by their doctors or by their family to make this decision. So Sarah's going to talk about a case.
So pictured behind me is a woman named Brittany Maynard. She was 29 at the time of this picture. Brittany was a graduate of UC Berkeley in California with a degree in psychology. Brittany was married for about a year, the last 4 months of which she spent with agonizing, debilitating migraines. She went to her doctor around New Year's and was diagnosed with a grade 2 astrocytoma, which is a terminal brain cancer. She was immediately rushed in for emergency surgery, where she received a partial craniotomy and removal of part of her temporal lobe. Brittany was in remission for a few weeks before her cancer returned, and unfortunately it had progressed to a stage 4 glioblastoma, and she was given 6 months to live. Doctors immediately recommended that Brittany undergo full brain radiation, side effects of which included complete hair loss, first-degree burns on her scalp, memory changes, personality changes, verbal impairments, and possible morphine-resistant pain. Brittany was also informed that as she neared the end of her life, that since she was young and healthy, her body could fight while her mind was cognitively gone. This means that her family would have to stand and watch while her body hung on to life, even though her mind was not cognitively aware. Brittany declined all of her medical treatment, and with her husband and family, she decided to end her life with dignity. Brittany moved to Oregon, where physician-assisted death was legal, and she soon became the face of the United States Right to Die debate, and she was featured in magazines and news articles. In a CNN interview soon after her diagnosis, she was quoted saying, "They try to mix it up with suicide, and that's really unfair, because there's not a single part of me that wants to die, but I'm dying." A mere 10 months later, she was interviewed again by CNN, and as you can see from this picture, the physical changes to her body as her disease progressed were drastic. She was quoted in this interview saying, "Who has the right to tell me I don't deserve this choice? That I deserve to suffer for weeks or for months in tremendous amount of physical and emotional pain? Why should anyone have the right to make that choice for me?" On November 1st, a month after this interview, Brittany decided to end her life with dignity in the comfort of her own home at the age of 29, surrounded by her family and loved ones. Her last public statement was, "Goodbye to all my dear friends and family that I love. Today is the day that I have chosen to pass away with dignity in the face of my terminal illness, this terrible brain cancer that has taken so much from me, but would have taken so much more."
So you guys are probably wondering how this is applicable to us as PTs, but as more bills are passed and this topic is becoming more prevalent in the United States, we as physical therapists may encounter patients who are faced with this dilemma. So as PTs, our profession is very communication-based. We develop really great relationships, and so our patients might confide in us in topics such as PID. Therefore, we have to be educated on the most current research and the most current legal status of this law, and in order to provide them the best education that we can. We also have to be empathetic to their wishes.
Just like everyone said, you can see that physician-assisted death is an undeniably controversial and sensitive subject. So physician-assisted death does allow patients to choose the timing and manner of their death, giving them the option to die with dignity. It enables them to avoid the pain and suffering that usually accompanies the death of someone with a terminally or chronically ill disease. Legalizing physician-assisted death would open up this option for patients and doctors whose cultural and religious beliefs allow them to participate in this practice. It is important that as medical providers, we respect our patients' wishes and beliefs, but also give them all of the education that we have available to us. Every patient should be treated as an individual and be given the option to take their lives into their own hands.